higher order drugs, including metals and minerals. And they, as I already said, that initially physician I will prefer that plant origin drug and then go for metal minerals later. So this classification of food we can find in classification that over right. In that, almost 250 mineral origin drugs have been listed under various categories. That is, one of them we have categorization for metals, chloroform for all salt, and ammonium for jet, and phosphorescence for arsenic and other and uberous bioorganic vanilla and so overall we have a broad classification of drugs where the internal medicines we have 132 types and categories and that is both or and therapy is external. That is also we have 32 types. So in the Agamaranda, that is the type we have a different classification, different categories of sponsor. Mostly you can have the similarity with other and just I will be skipping this terminology should be aware that starting from Surah Kuridir. Kuridir is a development of and Kali. Kali is also a specific dosage for it. That is and we have the Churnam Pit, which is the steam product of the Churnam. And based on other classifications also, we this monopause that is a syrup-based tea, we call it as medicated tea. Rasayana, we have a particular dosage form, similar to type of and we have separate that is 11. And apart from that, xylem, martin, and martin and we have a peculiar type of dosage form where that is we can the English equivalent whatever the possible equivalent but we call it as a spiral, vertical spiral. Whatever fragments or the sediments we have after doing the like further continuing with this, we have our another one that is called as internal medicine, where the herbal and herbal combinations are that is used in a solid form and commonly many people would have known about the Rasaganda medicine, Siddha formulation for a medicinal formulation, which is widely used for all high infectious diseases, even including HIV was widely used AIDS and China. This type of dosage forms has been classified under the internal types and as I mentioned, the unique formations for the we have it as a Chanduram, which is a calcined product, which has been majorly it will be a red color, and the Chunam is also a calcined product. It is also based on the mineral origin drugs. And we have other classifications like Katti color, which is of higher order drugs. Even the very minimal dose of it works in a different way where we cannot imagine even if it is an emergency condition also this has been administered. But somehow unfortunately we have uh, missed out these Colombian country. But now our team is reviewing with the Siddha Research Council and other teams and national they are working on it to review this type of formulations. So, as you all know, you will be actually we should stick on the Drugs and Cosmetics Act and rules. But however, I want to address this concept is also been mentioned in classical technology, where the different dosage forms having a different shelf life have been mentioned. Even we can find that Chinduram or any Padangam, that is more than 10 years of, and we have that concept of perform, which is more than 100 years. So this actually we have this classification, and due to some other reasons of sitting on the shelf life that way in industry, and most industry are supposed to by those guidelines in that whatever mentioned in the. So, especially for the peculiar formulations, as I said, Siddha, we have many literatures where I want to quote some of the examples of their area. There is a classical text where you will find that some slokas text, that is, we call it as Sayyid. It may be maximum of 4 or 5 lines. Within that 5 lines, all the law drugs have been mentioned, and the standard operating procedure would have been mentioned, and also the therapeutic use with the different methods. Within the 4 lines of our Sayyid, those things have been mentioned in the next column area. Just like quoting this example of iron, based on that iron calcite product, there is a white color finished product where equal you can call it as the plasma in Ayurveda. And see, the examples I have given is the uh, four herbal juices are used for processing this iron. And they have mentioned the quantity of the herbal juice to be taken and the number of days of considering that the medicine is able to particularly. Say, for example, if we take the Vende Verpattai, that is the call it as the Vende, this is equal to your days, and the herbal juice to be taken is 7 solam, and the number of days to be considered is 7 days, and the filling, that is the tablet drying days, it is mentioned as 5 days, and after that we are making the preparation for the food, where it is placed in a one crucible and sealed it, and for sealing also they mentioned the date and the number of quantity, that is how that takes to be used for food. That also has been mentioned. Similarly, the different classification of Chinturam, all that also they mentioned some 7 to 8 herbal juices to be used, and the quantity, number of days of refrigerating, and tablet drying, and seed drying, and number of powder cake variety to be used in food. And regarding the drug standardization, we have the concept of equal to grains or millets. That is the that has been mentioned in multiple texts. And even for administering the drug, we have mentioned that different the size of that size, whatever the millet. So in that, it is mentioned as some of the best dosage can be administered to the patient, and if it is a maximum, that is moderate dose that can be administered to the patient, and if it is a kadamam, that is that is not be administered because it may cause side effects. This concept is the now actually the like already we are publishing with the equivalent English equivalents where see this, and recently Siddha, they entered into an MOU with the MPS validate those standards based on the institutions of national parameters. And as I said, for that, with that text of a very relevant one, we can find different attributes for a single drug. Really, you can find some 10 to 20, 25 attributes that mentioned for different therapeutic So, this point we can address to anybody who is unaware of herbal formulations. As you all know, the traditional medicine especially Siddha Ayurveda. We have this because they have the advantage of the minimal dosage and the palatability and the quick absorption effectiveness, longer shelf life, and the easy to store and easy to transport. These things we have the advantages of formulations. So in this Siddha system, because of it is the system of mostly from there, and this is also the reason of beneficial concept for the pharmaceutical. So there is another mention about whatever the formulations we are using. That is based on that we have different categories. Yegamurian Prayogam, that is a single drug therapy. And as I said earlier, there is a network therapy concept where is a modern Prayogam is mentioned. And other discipline, as they need is a different technique concept. Where this JD and now we are using it in processing the model drugs and the metals, minerals. So another one unique concept we have that Punir. Punir is the most popular set. We can equivalently call it as the popular set. And this is the collected and calcined most of the populations. Even it acts as a catalyst in populations. As you know, standardization of a drug is a significant of any medicine where populations are used specific procedures of calculation methodology are used. This has a obvious cost only, but as far as pharmaceuticals are concerned, they are not of the commonly used or any practically feasible for industry or academician or a research person to follow that. And as far as it is to be supposed to be industry friendly, you have made it as a simple one with maximum possible is HPTLC and AAS and nothing more than that. So this traditional medicines, especially in Siddha, we standards are to be worked out by experimentation and observations only, because we cannot fix the blanket standards for everything in traditional medicine. So just I'm skipping these with the concept that the formulation, the standardization will be dealt by would have been dealt by other lectures also. So I want to just talk about the limitations in Siddha, where Siddha formulations, where it is a mostly the mixtures of many constituents. The active principles in most cases are unknown. That is, maybe the analytical markers would have been known, but we don't have the evidence-based publications or studies for therapeutically useful markers. So this is actually talking about these variations, whatever we face in climatic conditions and the different geographical conditions. We have that cultivars being now, because of medicinal plant cultivation being encouraged throughout India. We have different variants of cultivars now, and the method of harvesting, drying, storage, everything makes a impact on the formulation. So, other type of limitation, what I just want to address before you is we are talking about this perform, especially of animal origin drugs or bio mineral drugs, where we can just take an example of Muttu perform in Tamil. It is obtained from pearl, and the Pavalam is coral, and the Changu is our conch. In these three, we chemically we can see that it is only calcium carbonate or nothing other than that, with some traces of some other minerals. But however, we have this difference in a classical text where it is administered for different disease conditions. So this limitation where we cannot adhere to these pharmacopoeial standards, or only this part will talking about the quality of the preparation of the process and not about the quality of the efficacy of the drug. And one more thing, as we all know, whatever the available equipments or any testing methodology, it is mostly of destructive nature. Only some few recent equipments like X-ray, photoelectron spectroscopy, or we call it as XPS or SCA, that we go for non-destructive methods where we can elucidate the probable organic structure of any complex of medicine. But analytical methods are mostly destructive, like AAS and ICPF. So this I'm just skipping on this with the last point only to address where we have that different geographical areas mentioned in the five different types of land. Accordingly, the medicinal plants combination of the medicinal plant variations will be there according to the land conditions. Where Kurunji, it is a mountain and associated regions. Mullai, it is a forest and associated region. Marudam, it is the agricultural land and associated region. Neithal, it is a seashore, and Palai, the last one, is the desert area. So with this, we can just example I have shown here is the most of you might be knowing about the seasonal collections of raw drug, and especially fresh herbs when it is procured. We stick on to that seasonal variations, and whatever the possible season the active principle may be of higher quality during that season only it should be collected. And most of the thing we can observe that wherever the disease conditions have been mentioned against any season, that during that season these herbs may be available in excess quantity. And the whatever the adulteration or wrong collection or misidentification of any raw drug, it plays a major impact on the standardization. It is usually we call it as it create impact on safety and efficacy, but also we have that problem with the standardization of those drugs also. So especially when we talk about mercury, we have a concept of purifying the mercury with just removing those seven totems in that. We call it as a totem or sattai, which is to be maybe removed, or which is to be purified. And we have that concept, and without that, if it is used, it may lead to diseases like skin ailment, hemorrhoids, neurological ailments, respiratory ailments, and death. This has been mentioned in Siddha literature, the very old classical text also. So why do we have this type of discussions where we address that everything should be having some good practices, like for example this good agricultural practice, good field collection practice, good manufacturing practice. Already GMP is being known to everybody, but based on this GAP or GFCP, then only we can go for a GMP, literally speaking. But as of industry is concerned, we have that schedule. As per that schedule T, we have to go for any GMP certification. Without that, nobody can manufacture and market the products. So GLP and GCP, it is mentioning about those things. And finally, we have that pharmacovigilance concept. These comprehensively looking after these concepts, then only we can think of any standard or quality drug. So this is the challenges already, limitations we are being talking about, and the challenges where these products has to be whatever the traditional medicine formulations has to be manufactured, having a controlled standard only. Without that, we cannot achieve the quality or efficient standard traditional medicine. So to conclude with this, we have just pointing out the summarizing this session. Drug standardization is extensive and involves contradictory theories on the subject of Siddha medicine and its relationship with the human physiology and mental function. And especially for regarding the Drugs and Cosmetics Act and rules, the development of elaborate quality control and quality assurance aspects needed to produce safe and effective Siddha medicines. And regarding the research and development of Siddha or any traditional medicine, this extensive concept of involving all the good agricultural practice, good field collection practice, and following a good manufacturing practice, should everything should be integrated, and it should have a common impact on the drug. And finally, just address to the gathering regarding talking about the harmonization, where different pharmacopoeias mention different standards, uh, and we have brought out with one herb one standard policy of Ministry of Ayush, and we are working on that, as you all know. And in this, we are working on to harmonize all the common monographs used in different systems of medicine, Ayurveda, Siddha, Unani, and even homeopathy. And later on, now we are ministry has included Sawarik also in this. So this work is being carried out. And to conclude with this note of WHO, internationally acceptable standards for traditional medicine, including manufacture, registration of products, practices, and practitioners, post-market provisions will become increasingly relevant and will provide model for international harmonization. So WHO has brought out with international herbal pharmacopoeia, where it is emphasizing that all the standards available throughout the world, it should be harmonized, and this is also being taken up, and we are also looking for to be part of that international pharmacopoeia. Thank you.
Sir, can I ask a question? Yeah. You have mentioned that this grinding process is for 13 days in your slides. So how it could be done, and what machinery or equipment is being used for so
See,
many days?
see that they have mentioned about the date of maturity. Certain quantity of herbal juice should be used. Say, for example, if it is just mentioned as some 250 ml or so, then the 250 ml has to be used for saturating that, and almost the daytime only we used to saturate it, not at the night. So specifically for some formations, we have that for throughout night or it could be saturated. So based on that, your climatic condition it may differ. So we cannot take it as a standard for all climatic conditions, because when we are going for any industry in South India, the humidity will be more, and there may be a scope for many infections or microbial growth. But when you compare with North India, where the climate may be extreme climate, where suppose if it is a winter, it will not dry out soon. So these things we have to practically. That's what I mentioned about the experimental based and observation. So based on that, we have to prepare our own standards. No, actually, it should be manually saturated. But see, for the large scale preparation in industry, already in Siddha also we have mechanized everything. So even the album, we call it as a करेल जो आयुर्वेद में यूज करते हैं, उसको भी मॉडर्नाइज कर दिया, पूरा ऑटोमेटिक कर दिया है. So that is being followed because industry when going it for a larger batches. Still, I remember one of the private industry where I have worked. So one formation that Abraga Perform, it is having 100 quotas. So it takes almost 2 years to complete one batch of almost 5 to 10 pages. That's all. So for industry, that period of 1 to 2 years is very lengthy, and if they complete that, and the product is coming into the market, within a few days it will be completed, because many number of doctors are there, many requirement is just expounding now, and even Minister of Ayush with the Central Council for Research in Siddha, they are bringing up many Siddha units. So now we are just gradually we are creating our brand in all the states also, because
What
the
will be the quantity if 2 years it is taking with 5 kg? Then what will be the dose you give to patient? Because
no
if it
patient,
is a
see,
large
that's what I mentioned.
masses,
For the patient, it will be very minimal dose. So based on that, formulations differ. Say for example, for the Ayachandura, it is mentioned as only some maximum of 60 to 65 milligram per dose. So different concepts are there, and even that's what they have mentioned about this millet size, whatever to be used. Have you seen that सामई 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 के चावल जो है उसमें एक जो ग्रेन है उसका डोज कितना होगा? Maximum of some 20 or milligrams only, 20 to 30 milligrams, less than that only.
preparing juices, you use the dry material or
No,
fresh
obviously
plant
it is fresh
material?
one.
Fresh only.
Fresh.
So again, it is
Nowhere,
a task to get a
nowhere,
fresh plant or
yes,
fresh
nowhere in
root.
the preparation of any tanduram or perform, they have mentioned about this preparing of kwata, kashayam, like that decoction type
Things
of
may
thing.
not be readily available when we are going for preparation. So it is a task.
No, see, that is the practical difficulties where,
Ah, yes.
see, one they have mentioned some 4 or 5 herbal juices. Then each one should be planned accordingly, and it should be collected accordingly. So, and for industry, that is more Herculean task that QC has to clear that. So when it reaches the RM store, the QC person has to clear that. Then only it will be taken up for production. So it involves a complicated task actually. Yes, yes. See, running a Ayurveda, Siddha, Unani industry is very, very difficult, because, as you all know, in the allopathic industry, nothing to worry about. They can just get the standards easily, and because it is of only single molecular approach. But we don't have that easy concept of manufacturing. And in turn, we have the same Herculean task in developing the standards for those.
Ask, you have shown shelf life for 100 years, 500 years, and 75 years I have seen.
That is only based
What could
on,
be the reason so long it is, and how to preserve?
no, no, see, this is based on our references, classical text references into that. And even um, I heard that my colleagues from Ayurveda, they said that some of the formations they have that it has been mentioned. But in Siddha, we have the peculiar type of classifications for those things. And maybe one concept what we hypothesize is it may be regarding the half-life of that element, or half-life of that metal mineral, whatever has been taken. So based on that, it will been given. But as far as our knowledge, and as far as my experience in standardization, so we analyzed that product, any perform or Chanduram. That's what I talked about, the XPS, where the ESTA, electron spectroscopy, no difference in the organometallic complex. There is no difference at all. And even the microbiology content, when it is stored in the proper container as advised, is not creating any difference. Because if you keep it in a loose container, or if you are keeping it in a not proper condition, then the microbial growth is there, where it may hamper the efficacy, or it may create some side effects. But especially the perform syndrome herbal products, we don't find any changes in the complex organic structure, because when we go for the XPS analysis, that complex organic structure, that complex is not at all deteriorated. It may be a organic complex or inorganic complex. No, switch on the mic, please.
What I know is Siddha is more talking about metallic oxidation.
Yeah, this is a wrong perception. That's what I want to address here.
Yeah,
Where most of the public they think that even in Tamil Nadu they think that Siddha is using only metal mineral. It's not like so. We use all polyherbal formation also, single drug of plant origin drug also, and this herbo mineral and the metal mineral combinations, and even animal origin drugs. So, looking on the percentage of use, percentage of utilization, mostly it is based on plant origin drugs, and more higher order drugs, higher accurate drug formulations are mentioned in Siddha. When I talked about the tattu, we even in my childhood I have seen that because it will be a just like a ball structure only. So that Vaidya or a traditional practitioner will be bringing that in a box where it, different cuts he will be having. Tangam, that is a gold cut, Cinnabar, Lingu cut, and just he will be rubbing once or twice in a stone, rubbing stone, with some herbal juice, and just the medicine will be just coated on the tongue. Only 2 or 3 doses. It may be a high fever, it may be some scorpion sting or any poison. Immediately that the patient will recover. So actually, that's what unfortunately we missed those dosage formulations in the timelines, and now just we are starting and reviving that with the help of some traditional ideas.
Do
See,
you have
creating the standards for this again, it will be Herculean task.
any success stories in Siddha which we can read from literature or any books published through council?
No, what is it?
Success stories
No, there
from
are many.
Siddha.
There are many. We
Where
see
can we
we have
get?
in Siddha Central Council for Research in Siddha is there. They come out with all research outcomes, and we have a National Institute of Siddha where our professors are also there in our field now, and they also have all PG and postdoctoral doctorate degree there in their curriculum, and they are also bringing out some research publications. So there are many success stories. They even, if you ask our team from NIS, they will talk about clinical success because almost now they have more than 2,500 patients per day. Footfall is more than 2,500. You can anybody can go and visit that hospital there. And yes, and Central Council for Research in Siddha, they have a unit here in Safdarjung Hospital in Delhi, and they have Dr. Akila is there. She was in charge there, and they have their units in Goa now, Bangalore, and they are just expanding their origin. And especially the uh, success stories you can just go through regarding this COVID pandemic situation. You can see about the publications on Tabasara Kudinir, which is a polyherbal formulation of Siddha, where the first publication was based on that molecular docking study. So now the concept of standardization will be based on this in the future, maybe, because we need some evidence based. WHO is also insisting that it should be evidence based. So now going for animal trial or all clinical trials for all formations, it may be practically not feasible. And going in turn, we are going for this molecular docking studies or in silico studies. It may save the main concept of creating evidence for all predictions. So you can go through the publications in many journals. It has been Tabasra Kudinid is a highly successful and in COVID condition. And earlier we had that chikungunya where polyalphalgia was the major symptom, and many patients suffered with it. And we had a successful formulation which was very effective, that Nilavimukudini in Sita.
In Ayush kit when pandemic was going on,
Okay,
we received this kit at our
you are
institute.
from
I'm from CCRM at Hyderabad,
Hyderabad.
Peripheral Institute.
Okay,
Sir,
yes, sir.
actually, Maddanam Gunavardhayet.
Ah,
Your titration process, it goes to finest particle. Up to what nanometer size it will go to?
so this is still under evaluation.
Are there any STEM studies?
No, sir, we don't have that STEM studies in here. But my experience is with Indian Institute of Chemical Technology, Hyderabad. where we had that almost one study of this Abraga Bhasma in Ayurveda, and equivalently we have that Abraga Chenduram, and that has been analyzed, and where actually it was not published, but we could not publish that data due to some reasons. Where the Ayurvedic, the Abraga Bhasma, it was around from 10 to the power of minus 10 or something, and the Abraga Chenduram, it was nearly some 10 to the power of minus 12,
Yes.
so little bit finer.
Yes. Thank you. But with STEM studies, we can evidence based.
Yes, sir. But see, again, the problem is that cost. It should be cost effective. You can do this for research purpose. We have STEM or TEM or anything. You can go for research purpose. See, even the data in my ESCA, it will be giving a external structure only. What is the outer surface? It will be the organic complex. It will be there. But talking about more thing, when we go for a active principle or so, or identification any polyherbal formulation, if you go for identification of isolation of molecule, then it is not at all feasible for a traditional method.
Sir, that colloidal gold or colloidal silver, they
Yes.
are equivalent to the nanosize up to 5 nanometers like that. Are there any comparison with that with those now present? They are using no colloidal gold and colloidal
Sir,
silver.
no,
Is there
no,
any
no,
comparison
sir,
with
no comparison at all as far as my knowledge is concerned. Because see, whatever the nano particle now they are using, this concept is actually totally different from our traditional. In traditional medicine, it must be almost that the final product may be analyzed for any number of analytical methods, but see, the whole final product it will be some metallic complex only. It will not be in the elemental form. That's what traditional medicine also says. It should not return to the elemental form. Whenever we test any perform or synduram, it should not be having the traces of element. But whatever the nanoparticle we have, that is almost elemental form only. So that cannot be compared at all. We
Sir,
should have some our unique parameters or unique testing methods. One, most of you are from Andhra. It seems that
yes,
Namburi spot test you would have
yes, sir, yes, sir.
been knowing that. It's a very excellent method. Unfortunately, we are not using that.
But let us go up to SEM level, sir.
Yes.
sir, thank you very much for this informative lecture. As I understand, I'm not from Siddha system of medicine. As I understand from this delivery system, most of the drugs are used in nano ranges, micro ranges, and CCs and like this. So why we are not trying for some novel formulations like nanoparticles or something that is more useful?
So that's what, sir. See, when you talk about nanoparticles, what the concept they have is completely different, and what we use is completely different. So still, we do not know the there is no proper evidence-based publication for our pharmacodynamic or kinetics for this performance. In what way it acts in the body, that we know. But the nanoparticles, even you can trace that. So similar concept of evaluation we can use, but again it involves more budget and so. And who will be ready for that? We do not know.
Sir, in second question, with respect to formulation optimization, as I saw, most of the formulations, what I referred from the book on internet, my knowledge is very limited in this area. So they are fixed formulations almost, but actual content strength quantity is missing. That in this means some mixture which is present in which quantity, that is like compound X, compound Y, compound Z. It's a
Yes,
mixture.
yes.
So how much quantity of X is present, how much quantity of Y is present in that formula? That is missing. So can we address that one?
So can you quote
Means
with some
it's a mixture
examples?
or some like curcumin or something. It's well defined. Like in curcumin longa, this is already well defined in other medicines. I don't know in what.
So you are talking about active principles,
Yes,
markers.
yes, marker.
So
That
that's
need to
what
be decided, no?
markers as far as traditional medicine is concerned. See, when example for curcumin, if you say that curcumin should be this much percentage in our normal turmeric product sample, then you may not land up in a good product if it is only the curcumin only there.
Yes, that is not water soluble.
So in traditional medicine, we are talking about the holistic product, which may be having some that what we call it as the
then how
antagonist.
then how you ensure the clinical aspect, because you don't know what will happen, how much dose
Yes,
patient is receiving or what.
yes,
So actual how you are going to ensure that after giving this much dose, that much kind of pharmacokinetic will take place.
yes, sir. That's what. See, as far as drugs and act and rules is concerned, for a classical reference product, we will not go for any clinical trials. So that is one exemption we have. But again, while we just when we are going for validation of those things, we have to think of this modern techniques where what I'm talking about the in silico studies or any uh, docking studies, or even you can go for some what to say the in clinical trials it is a double blind study. But again, the problem arises regarding the techniques used and even the randomization used in a clinical trial. Say, for example, I am using a external therapy where we have one specific therapy system called Verma. In that, we cannot go for a blind study. We cannot go for a double blind study. Similar way in herbal formulations also. If it is a reliable kudinir, it should be a bitter taste only. Again, mimicking it with some bitter taste, bitter formulation. Yes, that is a little bit complicated thing, and somehow our research fellows they are managing with that. Even our PGs, they publish their thesis. We are managing with the base level concepts. So when it goes for the broader platform, you know, the two, especially similarly, we talk about all Chinese medicine. What they did is that they have segregated their type of traditional medicine. So one is classical Chinese medicine, and other is for global. So in that they have come up with all ginseng and everything, and they have made active markers, therapeutically active markers also. They are marketing. So still we have many miles to go,
Sir,
and the Ministry of Ayush is working on that. Even BIS, you would have heard that they are in this Indian standard. In that also they are accommodating these standards. Ayurveda, Siddha, and Unani. They have a separate section for it.
sir,
Sir,
here,
shall I talk Tamil only?
Thank you.
Shall I talk
If it
Tamil?
is in English, better
Okay.
everybody will understand. If you
Ah,
are convenient, you can talk in
okay.
Tamil, no issue.
Okay. Sir, actually, while we are starting Sita standardization herbals, sometimes what will happen na,
Yes, yes.
இப்போ டிகாசனா இருக்கிறப்ப நம்மளுக்கு அது தெரிஞ்சிரும் சார். இப்போ அதை சூடு பண்றப்ப தான் வந்து ஒரு ஒரு கான்ஸ்டியூண்ட் உள்ள இருக்கு. அதை நம்ம சூடு பண்றப்ப அந்த கான்ஸ்டியூண்ட் வந்து ஆக்டிவா வெளியே வருது அப்படிங்கறது வந்து இப்ப நிலவேம்பு சூர்ணத்தை வந்து நம்ம கொதிக்க வைக்கிறப்ப தான் அதுல உள்ள மூலக்கூறு வந்து வெளியில வருது அப்படிங்கறத நம்ம தெரிஞ்சுக்கணும் சார். அதை வச்சு நம்ம பயோ இன்ஃபர்மேட்டிக் இன்சிலிக்கோன் போறப்ப ஒரு ஸ்டேஜ்ல என்ன ஆகுதுன்னா நம்ம அதோட பைண்டிங் எனர்ஜி எல்லாமே கண்டுபிடிச்சிடுறோம். அதை வச்சு நம்ம எல்சிஎம்எஸ் ஜிசிஎம்எஸ் போறப்ப ஒரு சில இடத்துல வந்து நம்ம லேக் ஆகுறோம். ஏன்னா இந்த ஒரு ஒரு ஸ்டூடெண்டா ஒரு ஒரு மாணவனா கீழ இருந்து ஒரு ப்ராஜெக்ட் ஆரம்பிக்கிறப்ப அவனுக்கு ஃபண்டிங் சோர்ஸ் அந்த ஒரு டெங்குவோட செல் லைன்ஸ் மட்டும் 1,50,000 அந்த மாதிரி ஒரு செல் லைன்ஸோட இது மட்டும் 1.5 lakh இட் இஸ் கம்மிங். ஹவு இட் வி கேன் ஓவர் கம் திஸ் இஷ்யூஸ் அண்ட் ஆல்சோ எப்படி இதுனா
You are talking about budget issue.
எஸ் சார், அதானே சார் பிரச்சனை.
No, see, when you have a research grant, you can go for highly complicated studies.
எஸ்
That's what we face. See, even ICMR is working on that. As you know, that NITM is there,
எஸ் சார்.
which is working on traditional medicine, and they have developed even some quality standards for many herbal formulations.
ஆமாம் சார்.
When you talk about this in silico studies or cell line studies, then we have that budget issue everywhere. Unless you get some grant or do some project on that, then only you can go to it.
எஸ்.
So this is beyond our thought now. Because
எஸ்.
see, as the PCM and Pharmacopoeia Commission, we work on to develop standards for AIC drugs. So we do not think about all that because we have recently we are entering into in silico studies, and just our pharmacology team, they are working on developing a zebrafish model laboratory. So further for evidence-based publications, it may be useful, but I don't know for pharmacopoeia and formulary, it may not be much useful as of now. Because in pharmacopoeia, we set a standard so that it should be industry friendly, and also it should be ensuring that safety and the efficacy of the drug to some extent. So safety is priority, and efficacy we don't know because when we follow the procedures in classical text, definitely it should be having that efficacy. This is what we presume.
Sir, here, what could be the reason of Siddha origin in Tamil Nadu and the classical literature available in Tamil language?
You are
Just
from Hyderabad, no?
yes,
So what is the difference between me and you?
I belong to Hyderabad. I
Ah,
stay there. I born there. That's
see,
the
whatever
reason.
now our
Because
friend
it's a
he
democratic country, no sir. Whatever there, it is spread to all across the country. What are the facilities right from the independence? So, what could be the reason? I just want to
uh,
know. Why only in
see,
Tamil?
so good,
Uh,
so good, but see, when it is Ayurveda, it is in Sanskrit only. Okay, why Sanskrit has been accepted? That's what. No, why it was come to all over India? Just think about it. One thing to be on this forum, I just this it is the domination of one culture. Okay, everybody should accept it. Okay, and we also accepted that as it is a one form of any. See, in Tamil Nadu, we accept Sanskrit as a devotional language.
Yes, sir.
So in all Andhra and Karnataka also they accepted that. In Malayalam, it is almost Sanskritized Tamil. So it is accepted throughout India because of that language and the culture. So this Siddha, it has been documented in only in Tamil. And see, for example, one formulation is there, Urai Matra. That is a pediatric dosage form. Just we prepare that in just roll the pills in the lengthy one, and we use it for the children, even infants, and up to the age of some 5 to 10 years also we use that. That is called as urai matre, and we rub it with mother's milk or even cow's milk or warm water, and just we make the baby to lick on that. That's all. But it is the best drug to create immunity and also to relieve all the digestive symptoms. This formulation we don't have in any other Ayurveda or Unani. Very effective drug, and it is a very economically cheap also. We don't have that because see certain cultures we have that is based on that some system they have developed and still it is in use. See, there may be many arguments where whether the Ayurveda came first, Siddha came first, nothing like that. So these are all based on our culture and whatever the civilization developed. Accordingly, some sort of systems have been developed. It has been effective because it has been used for centuries. So what I'm talking about the cut is even still now that family they are having that, but nobody knows that how to use it because they do not know what is it. That tradition is not found in this Unani or Ayurveda. They would have been because in Ayurveda I heard about the Potli. I think Ayurveda somebody is there. No? NIA. Potli is there, no sir? What is that medicine? Yeah. See, this Potli is almost what similar to this whatever I call it, but you are calling it. But recent centuries it has been in use in Tamil Nadu, Kerala, and even Sri Lanka. Parts of Sri Lanka they have it. But in Ayurveda that has been almost forgotten. And this Varmam treatment that is in practice even still it is live in Tamil Nadu. See, even a common person in southern part of Tamil Nadu, Kanyakumari district and Nagarcoil, they will be talking about this Varmam. Common language. If any child or somebody is fallen, immediately they say that Varmam Patted. Somebody they have hit with the Varmam. That is the Varmam points they will hit. Thank you.
reported, sir, in Siddha, in formulary? Maximum how many formulas have been reported?
Now, actually, we have 532 formulary specification. So we have three parts published now. So unfortunately, compared to Ayurveda and the Unani, we have less number of monograph formulations.
I have seen your Siddha, sir. It's very good and very nice publications. I have seen in good impact factor journals from Siddha,
Research
CCRS.
publication.
Yes,
Yes.
yes, very good output.
No, especially this recent COVID has brought out many publications. But, we do with because we have that national institute of high quality academic support, and even in university also we have good support there. But still we are expanding, as you said, because it is confined to Tamil speaking areas. It has not been known, and see, language is a problem. Whenever I come here to Delhi, I have to speak in Hindi only. Before that, I cannot manage here. Thank you. Sorry.
अच्छा हेलो हेलो आ जाएगी थैंक यू सर हाँ हाँ जी ओके हेलो हेलो हाँ कर रहा है लगा दूँ हमारे पास हैंडमैन हिंदी है लेकिन ये इजी रहेगा हाँ ठीक है.
Good morning to all. Next lecture is microbial analysis of ASU and H drug. The lecture will be delivered by Dr. Ramesh sir. He is a scientific officer, microbiology in Pharmacopoeia Commission for Indian Medicine and Homeopathy. And sir is actually the participants who are from homeopathic background. They were asking some questions for nosode and sarcode yesterday from Dr. Verma sir. So they may ask their doubt or whatever their question in their mind today. एंड सर इज ऑल्सो मेंबर इन BIS कमेटी, जो होम्योपैथी का एक BIS में जो कमेटी है, और हमारा जो होम्योपैथिक फार्माकोपिया सब कमेटी होता है, जो फार्माकोपिया पब्लिकेशन का जो मेन कमेटी है, उसमें सर मेंबर सेक्रेटरी हैं, मेंबर सेक्रेटरी, यस. सो व्हाट दिस इज गुड लेक्चर फॉर यू बिलोंग्स टू होम्योपैथी. सर थैंक यू एंड कम एंड डिलीवर योर लेक्चर.
थैंक यू सौरभ. आवाज आ रहा है ना? ओके. एक्चुअली मुझे तो पता है, मगर आई वांट टू नो अगेन, इसमें कितना लोग हैं माइक्रोबायोलॉजी बैकग्राउंड से? माइक्रोबायोलॉजी बैकग्राउंड? नो बैकग्राउंड. ओके. इसमें कितना लोग माइक्रोबायोलॉजी में काम में इन्वॉल्व होते हैं आपका ऑफिस में, डिपार्टमेंट में? जैसे रिपोर्ट साइन करना, जैसे यहाँ पे हमारा केमिस्ट्री है वो भी रिपोर्ट साइन करते हैं गवर्नमेंट एनालिस्ट जैसे. कोई भी नहीं है, आप कर. ओके, इसीलिए. ओके ओके. सो इसमें कोई माइक्रोबायोलॉजिस्ट है नहीं. ओके. सर आप कहाँ, किस डिपार्टमेंट से सर? सीधा. ओके सर, प्लीज प्लीज. सर मैडम आप होम्योपैथी से. मैडम इसमें कोई माइक्रोब्स को देखा है? लाइव माइक्रोब्स को देखा? आपको कॉलेज में कभी माइक्रोस्कोप में जब, हाँ जब देखे थे, अभी नहीं देख रहे, अब मैं दिखाता हूँ. कोई खाया माइक्रोब्स को? लैक्टोबैसिलस हम खाते हैं. ओके. मैडम आप बता सकते हैं आपको घर में कर्ड बनता है, कैसे बनाता है कर्ड? हाउ हाउ फर्स्ट फर्स्ट स्टेप कैसे करते हैं आप? मैडम पहले मिल्क को बॉयल करते करके कूल करते. कोई बात नहीं, कैमरा का जरूरत नहीं है. हाँ ठीक है. सो पहले मिल्क को हम बॉयल करते हैं. क्यों करते हैं मैडम मिल्क को बॉयल? स्टेरिलाइजेशन. स्टेरिलाइजेशन हमको चाहिए सिर्फ जो हम चाहिए बैक्टीरिया वही उसमें ग्रो होना है, अदर बैक्टीरिया ग्रो नहीं होना है, इसलिए हम उसको बॉईल करते हैं ना, बहुत गर्म करते बॉईल करते. उसके बाद क्या करते हैं, हम वेट करते हैं थोड़ा ठंडा होने तक. फिर उसके बाद क्या करते हैं, जो पुराना कर्ड है उसको डालते हैं. उसको वो क्यों डालते हैं? उसमें लैक्टिक एसिड बैक्टीरिया होता है, उसलिए वो ऐसे थोड़ा हम 1 स्पून डालते हैं उसमें. फिर उसके बाद क्या करते हैं मैडम? इंक्यूबेशन करते हैं 24 आवर्स. ठीक है. 24 आवर्स के बाद क्या होते हैं? कार्ड फॉर्मेशन होते हैं. फिर हम कंजम्पशन करते हैं. एक दिन ऐसे ही बाहर रखते हैं, फिर दूसरा दिन फ्रिज में रखते हैं. क्योंकि ऐसे ही बाहर रहे तो थोड़ा उसमें एसिडिटी ज़्यादा हो जाए तो सोरनेस उसमें बढ़ जाएगा, तो इसलिए हम फ्रिज में रखते हैं. फ्रिज में क्यों रखते हैं? टेम्परेचर 0 होते हैं, 4 डिग्री सेंटीग्रेड होते हैं, तो बैक्टीरिया मल्टीप्लिकेशन नहीं होते. देखो अभी मैडम ने माइक्रोबायोलॉजिस्ट है, मैडम ने मीडिया को स्टेराइल किया, मिल्क को स्टेराइल किया. ठीक है. उसके बाद मैडम ने बैक्टीरिया को इनोकुलेशन किया, फिर मैडम ने इंक्यूबेशन किया, फिर इंक्यूबेशन के बाद मैडम ने यूज़ किया उसका जो जरूरी है, उसको जो जरूरी नहीं है फ्यूचर के प्रिजर्वेशन के लिए रिफ्रिजरेशन में लगा. देखो माइक्रोबायोलॉजिस्ट का काम आपने कर चुके. शायद आप इसमें अलग अलग फील्ड है, मैंने सुना है होम्योपैथी फिजिशियन से, आयुर्वेदा फील्ड से है, कुछ केमिस्ट्री है, बॉटनी है, लेक्चरर्स, असिस्टेंट प्रोफेसर्स भी हैं, मगर जो भी है, आपका बैकग्राउंड जो भी है,
Excuse
मगर आप यस यस
my my topic in my PhD thesis, synthesis of green synthesis of nano silver,
ओके
uh,
एज ए एंटी
nano silver
माइक्रोबियल
and green synthesis of nano silver.
ओके
There I used that microbiology technique, uh, a, preparing AgNO3 solution and adding some herbal extracts that that AG ionic form turned to metallic form.
यस
In that
यू
way,
सी एंटी माइक्रोबियल एक्टिविटी
yeah,
एंटी माइक्रोबियल एक्टिविटी दैट
yeah,
non
com-
silver nano particles how
yeah,
they affect on
compared with our Rajat Bhatt.
yes oh, thank you. So whatever our background, okay, we are microbiologist, okay. जब बच्चे पैदा होते हैं पहले उसको कहाँ लेकर जाते हैं, वैक्सीनेशन में लेकर जाते हैं, पहले शॉट देते बीसीजी देते, जब फायदा होगा बीसीजी, बीसीजी इज ए बैसिलस कॉलमेट ग्वेरेंट, इट इज ए वैक्सीन टू प्रिवेंट फ्रॉम द टीबी, ठीक है। उसके बाद एक टीटी लगाते हैं, टीटी क्यों लगाते हैं, उसको जो क्लस्ट्रीडियम बैक्टीरिया होता है उस वजह से टॉक्साइड्स रिलीज करते हैं, उससे बचाने के लिए उसको टीटी इंजेक्शन देते हैं, एंटी टेटानस, फिर बहुत सारा पोलियो वैक्सीन देते हैं, सब कुछ, एचपीवी, हेर्पस वायरस। तो पहले से जब बच्चा फायदा हुआ था तब से ही वो मैक्रोबेल्स बन गया, ही इज escaping from the pathogenic microbes, okay, but he is moving towards the beneficial microbes। जैसे क्या कर्ड दही लेना है हम, तो हम उससे हो रहे हैं बेनिफिशियल माइक्रोब से। सो दिस सेशन इज नॉट ओनली फॉर द माइक्रोब्स दोज आर डीलिंग, so this is a general session, okay। So these 3 days you enjoy this Ayurveda, Siddha, chemistry, pharmacognosy lectures. Now this we will, if you have any doubt also we will interact between, okay। सी ये एक स्टडी है, हैदराबाद में है, ICAMR NIN, नेशनल इंस्टीट्यूट ऑफ न्यूट्रिशन का, ये रिसेंटली स्टडी है, वो पब्लिश किया है, बहुत हंगामा हुआ है इसके ऊपर। ये बता रहे हैं जो भी हर्बल प्रोडक्ट्स है जो मार्केट में अवेलेबल है बहुत कंटामिनेटेड, बहुत कंटामिनेटेड है। तो ये सेंटेंस देखने के बाद इज एनीबडी विल डेयर टू टेक हर्बल मेडिसिन? नो। इससे क्या होगा, इससे क्या होगा, हमारा ट्रेड कम हो जाएगा, हमारे हर्बल इंडस्ट्री को बहुत नुकसान होगा, कम कम बहुत नुकसान से बहुत, एनीबडी विल नॉट डेयर टू टेक हर्बल मेडिसिन। अरे ये क्या कंज्यूम कर रहे हैं? द मोटो ऑफ द टेकिंग मेडिसिन इज वी हैव टू क्यूर आवर इलनेस, we have to increase our immunity power, but when we are taking contaminated material, by taking only we are getting infected. So that's why microbial study is very important in herbal medicines. See, in recently also in Madhya Pradesh, recently 2-3 months back, 2-3 children died due to this herbal medicine consumption, okay। So this maybe they are doing microbial testing also, and their diethyl glycol is one of the reason, and also they are checking for this microbial and testing also. See, everyone know, so our lives before COVID and after COVID, how drastic, we don't say drastic, it is a very very drastic, okay। We lost so many lives, okay, so many lakhs of our expenditures, okay। So COVID, what we learn, COVID is a very good lesson, okay। You see now in those people using rickshaws, those people using rickshaws, they also use the sanitizer, they don't know background of the sanitizer what will do, but they know it will protect us, they use the sanitizer. And even metros also, even some people also now also wearing mask, okay। If anyone is sneezing, anyone doing cough, so they avoiding even in our house also, they don't dare to go for friend, because it is a lesson. If he is doing sneezing, so maybe that may be contaminated with us, okay, I also may be infected, okay। So a tiny virus particle. So how drastic damage was done. See, dealing. So every day morning, from morning to night, every day, every minute, every second, we're dealing with microbes. Okay. Sir has drinking water. If the water is not purified water, he's not there to drink. Okay, we are sitting in this chair. If these chairs are very dirty, no, we will not sit here. Every minute, every second, we will deal with microbes. Uh, can you say the difference between the two packets, up and down? The down is a tetra packet, and the up one is a PP. Okay, what is the difference between these two packets? Oh, is a tetra, and that is the plastic. Okay. Reason refrigeration is not required in tetra packet. Why? See, everything once you open consumption, you have to do, no? Within one day, you have to consume. See, the first packets are pasteurized milk. Please, pasteurized milk. Okay, you see that in labeling also they mentioned it's a pasteurized milk. In pasteurized milk, what they will do? They will boil the milk at 70 degrees centigrade, just 1 to 2 seconds. That's it. At 1 to 2 seconds, all microbes will not die. It's called pasteurization. Okay, that's why they give time period 3 months, 3 days. Sorry, 3 days we have to consume. They give the expiry date also. They give. Coming to Tetra Paks, they have mentioned sterile 140 degrees centigrade. They boil the milk at 140 degrees centigrade. So in what at 140 degrees centigrade, all microbes will be dead. Okay, that's why we can, when we keep in normal room temperature also, it will survive at least 6 months. They give expiry period 6 months, but once you open, you have to consume immediately. So this is the difference between the pasteurization, sterilization. So what is the importance now? This one, see, we also expect this type of products, this Tetra Pak products in our herbal medicines. Okay, this whatever we are consuming, it should be free from the pathogen. Okay, but whether we expect that one, being a natural resources, these herbal medicines are most 70%, more than 70% from the raw material, plant based herbal medicine. We are collected from the natural resources. Obviously they contaminated, obviously they are contaminated. So that's why our pharmacopoeia, they given some set the limits. Okay, this much level, okay, it is good for consumption. If it beyond that limits, so it is not good for consumption. So this slide is give the quality of the our herbal medicine. So we expect this our herbal medicines also this heavy shelf life. Okay, you know the microbiology, this microbes how they interfere with the herbal drug. If your product is very good, this free from the pathogenic bacteria or microbial load, your shelf life obviously increase. If there is a contamination, microbial heavy microbial load, that that material will be deteriorated, because herbs also very good nutrition source for the bacterial growth. Okay, see, now I previously I told pathogenic. Now you see everyone consume this yogurt. Okay, you see that labeling ingredient: active lactic cultures, streptococcus thermophilus. Okay, yogurt. So the yogurt is made from this active cultures. Okay, lactobacillus debrucans. Okay, you just see the this is the only one flavor, strawberry. There are so many flavors of the yogurt, mango, blueberries. Okay, so bacteria, microbes are not only harmful, they are also beneficial also. Okay, what is the use of consuming yogurt? Digestion, and it will protect our gut. Okay, and also some vitamin.
especially D vitamin, okay, and also in metabolism. So the use of the microbes not only pathogenic, some bacteria or some fungus are also in useful also. Okay, lack lack of turnover due to these microbes. Okay, for a small example, during COVID, everyone do PCR test. Yes, no, everyone COVID PCR test. Starting the test cost is 10,000 rupees. Now it is 100 rupees also. It will be in PCR. They use some enzyme, tag polymerase, polymerase, tag polymerase. This tag polymerase is isolated from the Bacillus thermophilus. Okay. Without this tag polymerase, the DNA will not multiply. DNA will not multiply. So why I'm saying this? This is an example. The benefits of the microbes also. Okay. So coming to our herbal medicines. Okay. So these are the natural origin. Okay. We are not expect natural sterile product from these herbal medicines. Okay. And also depends on the raw material, origin of the raw material. See, if anyone industry, I think Baxon or someone industry, anyone from industry. Okay. See, so the industry peoples will take this raw material. Okay. So they don't know origin of the raw material. They hire a contractor. Contractor supply the raw material. The raw material may be from the Himalayas to Kerala, or from Kerala to Himalaya or north region. They don't know authenticity of the raw material, where they cultivated, at what conditions they cultivated, whether they cultivated in a proper way or not. Anyone see commercial cultivation of these herbal medicines? Now it is come on a project basis. Commercial cultivation. Those are herbal industries are doing contract with the farmer. Okay, then they are giving they are also providing the seed, and they are saying that I need this much quantity of the raw material which is free from the herbal heavy metals, pesticide residues, microbial load. Then they will take it good rate. It is a commercial cultivation. See, beside that, the this herbal medicines will grow on somewhere in Himalayas, in roadside, okay, in drainage systems. Okay, so we will not expect a quality raw material. So that's why the origin of the raw material is very, very important, because based on the raw material only finished product will be there. If your raw material is contaminated, definitely your finished product will be contaminated with heavy metals, microbial load, pesticide residues. See, this 4 GPs, good agriculture practices. Okay, next, good harvesting practices. Okay, how he collected our this raw material. After collection, how he preserving, how he transporting to in manufacturing area. Okay, next, good manufacturing practices. So after coming to manufacturing area, how they don't go immediately for production. So they also need some time to processing. So they keep, where they keeping, what is the conditions of the room temperature, humidity. Okay, then after that, how they are cleaning, whether the raw material is cleaned properly, then how they are processing. Okay, this manufacturing practices. Next, good laboratory practices. Okay, good laboratory practice. I will give one example. Okay, so I received this sample. It is a, you can just imagine, it is a sample, Ayurveda sample I received. Okay, then I want to go for testing. I'm a microbiologist. Okay, this is a sample. Okay, in microbiology, we use medias, nutrient medias. Okay, then I take this sample and I pour on nutrient medias. Okay, then I incubate it for 24 hours in an incubator. Okay, but in every experiment we also keep one control also. In physics also, in sorry, in chemical testing also, we keep one control without a sample. Okay, so after incubation, in control plate also I got bacterial load without any sample. Even control plate also I got bacterial load. It means our laboratory is contaminated. Our laboratory is contaminated. I didn't write the result, okay, this sample is contaminated, so I written, okay, this sample is not standard, so fail. No, good laboratory practice is also important. Our environmental conditions, whether the specific temperatures are we are maintaining, and load, microbial load lab is maintaining or not. So that is also very important. That is called good laboratory practice. So these are the basic instruments required for the microbial testing. You know everything, biosafety cabinet, outer oven. This biosafety cabinet is a very important instrument in microbiology. Okay, so whatever the tests, whatever the analysis will do, we perform inside this biosafety cabinet. These are different types of biosafety cabinets are there. Okay, uh, you may hear this biosafety levels. Okay, see, based on the pathogenic nature, based on the pathogenic nature, there are four types of levels are there. Biosafety levels are there. Okay, see, first we example we already discussed, that is lactic acid bacteria. It is not a harmful. Okay, we can easily manage here. We can take the curd and we can work here easily. Okay, that is lactic acid bacteria. That is called BSL level 1 pathogens. BSL level 1 pathogen. Okay, normal hood or normal platform we can use. Okay, BSL level 2 pathogens. BSL level 2, these are the pathogens. Okay, they are the pathogens and they are the dangerous also. They are dangerous also, but we have a sufficient remedial, sufficient medicine. We have so many antibiotics for that one. Example, diarrhea. Diarrhea due to Escherichia coli. We have antibiotics. Typhoid. If we got typhoid fever due to salmonella, we have antibiotics. We have a specific remedy. That's called biosafety level 2 pathogens. Okay. Next, biosafety level 3 pathogens. Mycobacterium tuberculosis. See, tuberculosis, we have a medicine, but it is dangerous. It will take so many time, so many months to cure. Okay, so these pathogens comes under biosafety level 3. Biosafety level 3. Next, last most contaminated one is using Nipah virus, eh, dengue, Ebola virus, Nipah virus. Okay, we don't have medicine. Even corona also, even COVID vaccine, COVID virus also, we don't have medicine. Okay, so these are mostly contaminated pathogens. So this need a dedicated facility. Okay, this is called BSL 4. BSL 4 pathogens. Okay, in India we have only two labs have BSL level 4. That is one NIV Pune, National Institute of Virology Pune, and one DRDO also contain one BSL 4 pathogen. Coming to BSL 3, almost 25 BSL 3 labs we have. CSIR, ICAR labs,
Sir, now
some DST labs also.
in Thiruvananthapuram, one lab they are initiating. Sir.
RGCP,
Yes,
the
sir.
Regional Center for Biotechnology also, they got fund and they are under construction.
Yes, sir.
So based on our pathogen, so we use the this levels. So considering this, our pharmacopoeia, there are four specific pathogens are there: E. coli, Salmonella, Staphylococcus aureus, and Pseudomonas aeruginosa. These pathogens comes under BSL 2 pathogen, biosafety level 2 pathogens. Okay. Next, sample preparation. So I received a sample. If the sample easily water soluble, so I will directly add into the broth. Then I will go further processing. If sample is a non fatty insoluble in water, I will add a surfactant, that is polysorbate 80 or polysorbate 20, to easily dissolve of these samples. Okay. If the sample is a fatty product, so then I will add a polysorbate 20. Then I will boil it 40 degrees centigrade for 5 minutes. Then I will go for the processing. So this surfactants, polysorbate 20, 80, or they will reduce the surface of the sample. Then they will allow to easily soluble in solvent. Next method, suitability test. Okay. In method test, suitability test, so I received the sample for testing. Then I will done the microbial test.
I didn't get any microbes. I didn't get any bacteria. Is this sample is free from the microbial load? No. This may contain any antimicrobial agent or any antibiotic. That's where the results are coming positive, negatively. What I will do, then I will this is a sample came for testing. I will add a specific culture. I have a specific reference cultures like E. coli, Salmonella, Staphylococcus. I will add to this sample. Then this sample, then I will pour on media plates. If it will show growth, okay, they don't have any antimicrobial, any anti-inhibitory agents. Then I will go. If they have no, then also that there is no growth, then I will dilute it, or otherwise I will add some anti-neutralizing agents. Neutralizing agent I will add. Okay. Next, growth promotion test, culture media. Okay. So for our metabolism, we need different types of nutrients: carbon, nitrogen, phosphorus. Okay. Similarly, bacteria also require this type of nutrients. Okay. So we supply these nutrients in the form of media. Okay. There are different types of medias are there based on our applicability, how we are using that media, what is the purpose, what test we are going to do. Based on our applicability, we will use different types of medias. Okay. Generally, solid medias are, liquid medias are we will use. Solid media means just a broth, nutrient broth, we add a agar agar. Agar agar is a solidifying agent, then this media will be solidified. If you add 1.5, it will be solidified. If you add 0.7% or 0.8%, it is a semi-solid. Okay. If you want to see the motility of the bacteria, you can add a semi-solid. You can see the line of that media plate surface. Okay, that bacteria has a flagella and it is a motile bacteria. Okay. If no agar agar, then it is a liquid. It's called broth. It's a liquid media. Okay. So these are the basic medias required for the our microbial analysis of herbal medicines. Not only herbal medicines, even allopathic in any medicine, even food samples also, water samples also, any samples, and these are the basic medias required for the microbial testing. Okay. MLT. MLT is a two types are there in MLT: qualitative analysis and quantitative analysis. Okay. In qualitative analysis, these four specific pathogens should be absent. We will do testing for the four specific pathogens. In quantitative analysis, they give us some limits like a total aerobic microbial count, total yeast and mold count. Okay, we'll do these two parameters. See, each pathogens have more than three media, specific media, more than three specific media. This is a microbial limit test. Next, methods. Okay, there are different methods are there for performing microbial test. Membrane filtration method is there. Okay. Next, total plate count and most probable number method. Okay. So in membrane filtration method, you just see the sample. This is a sample, and this is a collector, and I will keep a filter paper, 0.45 microns filter paper. Okay. Then I will transfer my sample. Then after that, I will take this filter paper and I will keep on a Petri plate. Then I will incubate. After incubation, if I found any bacteria in that sample, I will get the colonies. Okay. That white spots are colonies. It's called bacteria. It's called membrane filtration method. Okay. Next, total plate count method. Okay. We use this method, total plate count method. Okay. These are two types are there. Okay. Spread plate method and pour plate method. Okay. Spread plate method and pour plate method. So in spread plate method, in pour plate method, okay, I received a sample, okay, and in pour plate method, what I will do, this is a petri plate. Just imagine it is a empty sterile petri plate, okay. So I will take a 1 ml of this sample and I will pour on this petri plate, okay. Then I will take a sterile media, nutrient agar media or SCDA, soybean casein digest growth or agar media. In case of I want to see the yeast and mold, I will take PDA, potato dextrose agar, or SDA, so saborose dextrose. Okay. Then I will pour this media on this petri plate. Okay. And but I have to ensure this media should be at 45 degrees centigrade temperature. If it is more than 50, 60, whatever the microbe, if any microbes contain this sample, they may be dead. That's why I will ensure this media temperature is below 45. Okay. And I will pour this and I will just shake it and I will keep aside. After 10 to 15 minutes, it will solidify. Then I will go and keep in inverted position in a incubator. After incubation, then I will note the forms. This is called pour plate method. Okay. In spread plate method, this is a empty plate. This is a sterile media. Then I will pour the sterile media. Now I will not concern about this temperature. Okay. I will pour this media and I will keep it for solidification. After 15 minutes or 20 minutes, it will media will be solidified. Then I will take this sample and I will spread on this with the spreader. I will take a zero 0.1 ml on that plate. Then I will media. Then I will spread it. It called spread plate method. Okay. See, compared to spread pour plate method, spread plate method is very convenient. So in pour plate method, every time you have to concern about the temperature. So that's why pour spreading is very important. We follow spread plate method. Most probable number method. This is a statistical method. It will not give a correct result. So this many colonies are present in this. This is a statistical. Okay, maybe 1,000 colonies or maybe 2,000 colonies. It is a statistical method. Okay, we will not follow this method. Next, yeast and mold. Same. How we bacteria will perform. Same method will be for the yeast and mold also. But we have to change the medium. We have to use the sabro-dextrose agar medium with the antibiotic. We use antibiotic also because in SDS, sabrose, dextrose agar also bacteria will also grow. So to inhibit the bacteria, we add a 0.5 gram of the antibiotic. We add a streptomycin. We will add, or tetracycline also we will use. Sometimes chloramphenicol also we use. So for example, so I received this sample for testing. This is a Ayurveda sample. Maybe you just imagine. So now I would go to perform the quantitative test. Okay. So what I will do, I will make for serial dilution. You know serial dilution? Serial dilution means I will take this 1 ml of this sample and I will take a 4-5 test tubes. Each test tube has a sterile peptone broth or sterile water. Okay. Then I will take a first 1 ml and I will transfer it into first test tube. Okay. The first test tube become 10 to power of 1, means I am diluting 10 times. Then from first test tube to second test tube, I will transfer 1 ml. Similarly, up to 4 or 5. This is called serial dilution method. Why I have to do serial dilution? I can directly pour on plate. I can directly pour on plate for observation of the load, microbial load. Because there is a large quantity of microbes will be there. Okay, it is very difficult to count, difficult to express this many number of colonies in this sample. That's why you are doing serial dilution method. So you are diluting the sample. Okay, you are diluting the microbial load. Then you will get a countable colonies. Then you will express this many colonies are present in this sample. Okay, see now in 10 to power of 1 I transfer spread it 0.1 ml. In 10 to power of 1 this many of colonies is noted. In 10 to power of 2, 3, 4. In 10 to power of 5 this many colonies. 10 to power of 6 this many bacterial colonies.
Okay, now I will calculate. So how much total population in this sample. So there is a principle is there, total number of colonies into dilution factor by volume of the plate. So for example, I got 60 colonies in 10 to the power of 2 dilution. 10 to the power of 2 dilution, I got 60 colonies, and I have taken this 0.1 ml of the volume culture sample. Okay, I got 60 into 10 to the power of 2 divided by 0.1. I got 6 into 10 to the power of 4 CFU gram. 6 into 10 to the power of 4 means 60,000. 60,000. 10 to the power means 60,000 I got. Okay. So whether this sample is okay, this is a sample is a pass the test, microbial test. The sample contain 60,000 colony CFU per gram. Whether the sample is okay for consumption, okay for it will pass the microbial test. No, yes. So for this, we have to refer our standard. What our standards is saying? What are the limits they are given in our pharmacopoeia? Okay, these are the limits given in our pharmacopoeia. That is API, SPI, UPI, HPI also. These are the limits. Okay, you see, for finished herbal extract and powders, the total aerobic microbial count is 10 to the power of 5. 10 to the power of 5 means 1 lakh. एक के बाद 005 zeros is called 1 lakh. I got 60,000. So it is within the limit. So my sample is okay. My sample will be passed. Why they given limits? In the first slide only I discussed. These are the natural source raw material. We didn't expect a sterile product. If you want sterile products, we have to boil the raw material. If you boil the raw material, heat the raw material, what are the active ingredients, what are the flavonoids, chemical constituents, it will be denatured. So there is no therapy efficacy. So that's why in herbal medicines we will not expect this sterile product, but some dosage forms like ophthalmic preparations. Okay, we that definitely need sterile. For oral consumption, for oral use, they give the limits. These are the oral use limits, internal use limits. Okay. In case of raw material means without any treatment, 10 to the power of 7. 10 to the power of 7 means 1 crore. They are allowing 1 crore. We will get more than 1 crore also. Okay. Because raw material naturally origin with contaminated water, soil. Okay, we will get more than 1 crore also sometimes. Okay. And the absence of 4 specific pathogens: E. coli, Salmonella, Pseudomonas aeruginosa, Staphylococcus aureus. Why only these 4 specific pathogens? There are so many other Vibrio cholera, Shigella, Mycobacterium tuberculosis. There are so many other pathogens also there, bacterial pathogens. Why only 4 specific pathogens? We due to pyrogenic capacity. So other also have no pyrogenic, because 2 reasons. One reason is these are the indicators, indicator pathogens. For example, your sample detected Escherichia coli. Okay, you may suspect, okay, if this sample is contaminated with Escherichia coli, may be contaminated with a effluent water or drainage water, or any contaminated water. This may be contain other bacteria also. Not only E. coli, they may be also contain other bacteria. So you can confirm, okay, E. coli, the sample is failed, is an indicator pathogen. And another reason is these 4 pathogens are emerging antimicrobial resistant pathogens, AMR pathogens. So you most of the listen this AMR pathogens. Okay, AMR is a very critical threat to human beings. We don't know how they are affecting. Okay, during our treatment also we don't know whether our medicine is perfectly working or not. Okay, see, just remember these pathogens. These are the most dangerous pathogens, escape pathogens. Escape pathogens. According to WHO, 20 billions of death occur in the world in last 10 years. So these are the antimicrobial resistance.
pathogens. That's why these pathogens also include in our pharmacopoeia for uh, these 4 pathogens. Okay, how this antimicrobial resistance will emerge? How antimicrobial resistance? See, I'm suffering with cold. Okay, in my house I have already found azithromycin. I taken azithromycin. Okay, 4 days, 5 days, I continuously take an antibiotic, that azithromycin. Okay, after that, I got a wound infection. Then doctor prescribed same azithromycin. It won't work. Won't work. I taken 10 days also. The my wound is not curing. I got pus formation. That is swelling and enlarging and infecting to other parts. Okay, because when you use this azithromycin, for what purpose? Cold purpose. Cold is commonly due to this viral infections. This virus don't have any cell wall. Okay, when you use antibiotic, where it is work? There is no cell wall. How it is work? How it destroy the virus particle? So that's why I already, whatever the bacteria have, that already get the resistant toward that azithromycin. When I got infected, it won't working. This is similar case to others. See, now who is prescribing penicillin? No, penicillin is gone. We already have penicillin resistance. Next, so many antibiotics are came. Tetracycline, no. Okay, vancomycin. Okay, next carbendazole. There are so many antibiotics are coming because this is antimicrobial resistance. Okay, even pets also they give so many antibiotics in pets and this goats and chicks. Okay, if we not boil properly before consumption, so we also get that antimicrobial resistance. If we get the antimicrobial resistance, it will transfer to others also. In in general, in ICUs, they will not allow to see the patient in ICUs. Why? Because the patient is already in critical condition. They got some surgery, they may got some infections, and I have a antimicrobial resistant bacteria, and I'm going to meet him. Then he get that antimicrobial resistant bacteria. When he used so many antibiotics, it will not work. So that's why antimicrobial resistance is very very important. So consumption of the antibiotics also we have to think thrice. Okay, whether this antibiotics work on this bacteria or not. Okay, if in a house it is just to lying freely, then we'll see, but it will not work. Okay. I have compared different standards in different pharmacopoeias. These are the WHO standard pharmacopoeias for microbiology. Okay, they also given same standard 10 to the power of 5, 10 to the power of 3 in case of yeast and mold. Okay, and these are the standard for internal use. These are European pharmacopoeia and British pharmacopoeia. They are also same limits, but they given some pathogens like E. coli, Salmonella, and bile tolerant gram negative bacteria. Next, this is Indian pharmacopoeia and USP. So in USP, they treat as a botanicals. They not treat as a herbal medicine. They treat as a nutritional dietary nutrients or botanical. They will also given same limits. Next, Brazilian pharmacopoeia. In Brazilian, they treat as a vegetables. In herbal medicine, they treat as a vegetables. And in Japanese pharmacopoeia, this is Australian their standard. So I compared the this limits in which pharmacopoeia they have given limit, how much they limit they are permitting, what are the pathogens they are permitting. I have made a comparison, and I have published this article in last year in Springer Journal. It is a good impact factor journal. This one, and I compared almost more than 14 pharmacopoeias, 14 international pharmacopoeias, and I compared with our API, HPI, UPI also. They are almost similar pharmacopoeia limits. Next, coming to qualitative analysis. Okay, now we have discussed quantitative analysis. Now qualitative analysis. Okay, qualitative analysis, we have to going to test this specific pathogens. Okay, E. coli. First one is the E. coli. So E. coli is a common pathogen. Okay, you will get everywhere. Okay, in our drinking water also we get E. coli, but that E. coli is based on the strains. What E. coli that depends on the strain. Okay, it is a pathogenic strain or normal our flora, normal flora strain. Okay, so I want to test whether the sample contain E. coli or not. Okay, E. coli is a gram negative bacteria. Okay, what I will do, I will, this is a sample I received for testing. Then I will take 1 ml of this sample and transfer it into 100 ml of the nutrient broth or lactose broth. Okay, and I will keep it for 24 hours incubation. That is called enrichment. That is said enrichment. I'm saying if any bacteria is, if any pathogenic bacteria is there, I'm encouraging enrichment. I'm doing encouraging. If any bacteria is there, it will be grow. It's called enrichment. Okay. After 24 hours, I will transfer 1 ml into McConkey broth. You just see first tube is a blue color and completely turns into the yellow color. If it is a E. coli. E. coli is a lactic acid producing bacteria. Okay, acid producing bacteria. Okay, and you see the down one Durant tubes there, gas bubbles also there. Okay, so I can confirm 30% it may be a Escherichia coli. Then what I will do, I will take 1 ml from this positive test tube to indole test. Okay, in indole test, I will add a Covax reagent, this test tube. After adding 2 to 3 drops, if it is develop a brick red ring, I can confirm it is a 50% E. coli, Escherichia coli. Escherichia coli is a indole producing bacteria. Other other gram negative bacteria will also produce. That's why I'm saying 50%. 50% I can confirm it is a E. coli. Then what I will do? Then I will take that indole positive culture to, I will streak on a McConkey agar. Okay, you can see the brick red colony. So I can confirm it is a 70% it is a Escherichia coli. What then after I will streak this colony and I will streak on EMB agar, eosine, methylene, blue agar. You see the Malkan sheen, green Malkan sheen. Okay, so I can confirm 100% it is a Escherichia coli. Then again I will do some gram staining test. Okay, so gram staining test, it is a gram negative bacteria. So then I can write, okay, this sample contain Escherichia coli. Okay, in each test I am using at least 2 medias. Okay, McConkey agar I use, and I use EMB agar, eosine methylene blue agar. At least 2, that will increase our confidential level. See, in chemistry, you take a, if you want to take the sample pH, you take 3 times, then you take average, and you can write it is a this pH is 5.5, 5.4. You write. But in microbiology, human interpretation is important. Okay, human interpretation is important. If you just use shriek on your media, okay, it's giving brick red colonies. Okay, it is Easter. No, even other gram negative bacteria also give same colonies. Even other bacteria also give same results. So that's why confirmation is very, very important, and human interpretation is also very important. So if I got then I can use another media also. If I am not sure, okay, no, this sample may not contain E. coli, I can use other media also for confirmation. More that give more clear results. Okay. Next, salmonella. Salmonella also a gram negative bacteria. Okay, same procedure. I will take 1 ml and I will transfer into 100 ml of the nutrient broth. I will enrich for 24 hours. After 24 hours, I will transfer into tetracyanate brilliant green broth. Okay, if it is turned, then I can confirm 30% it may be a salmonella. Then what I will do, I will streak any two medias. There are so many medias for salmonella identification. I can choose any two medias like XLDA, bismuth sulfate agar, or BPA. Okay, you see on salmonella it give a black colony. It is actually it is a total yellow plate. It turns into the black. So I can confirm 70% it may be a salmonella. Then after that, I will take this colony, then I will transfer it into a triple sugar iron agar. This is a media. That red one is a control. After incubation of 24 hours, it turns into the black color due to the hydrogen sulfide production. This salmonella produce hydrogen sulfide. Okay, so you see the black color formation and the bud formation also in the tube. Next, Pseudomonas aeruginosa. Pseudomonas aeruginosa, gram-negative bacteria. It is the most opportunistic pathogen in hospitals. Okay, and for this also same method, enrichment, and we have 2-3 medias for this one. At least 2 medias we will take, citramide agar or fluorescent agar media. Pseudomonas aeruginosa is a pigment producing bacteria. Pigment, greenish pigment will produce, and it will give fluorescence under UV light. You see the fluorescence under UV light. Okay, you see Pseudomonas aeruginosa. Then you have some biochemical test like oxidase test. If you have a reagent and we add some culture of this Pseudomonas aeruginosa, it turns into the blue color. So it is a oxidase positive. Pseudomonas aeruginosa is a oxidase positive. Next, catalase positive. What is catalase? Catalase positive. It is a this organism is a catalase positive organism. So we are also catalase positive, catalase negative. We all are positive. We are aerobes. We are aerobes, na? So there are in bacteria aerobes, anaerobes also there. Aerobes means they take oxygen. Okay, anaerobic means they will not take oxygen. They take carbon dioxide. They are anaerobic bacteria. Okay, we all are aerobes. We take oxygen. Okay, if you may observe if you got any wound or injury, they pour hydrogen peroxide, gas bubbles will come. Okay, so our tissues, whatever the oxidation metabolite is there, they give the aerobes. Okay, catalase, that enzyme will break the H2O2 and the H2O convert into the oxide, so give the gas bubbles, superoxide mutase. Okay, so Pseudomonas aeruginosa is also a gram negative bacteria, catalase positive bacteria. Next, Staphylococcus aureus. Staphylococcus aureus is a gram positive bacteria in most pus forming bacteria. Okay, wherever you get the pus formation, it may be due to the Staphylococcus aureus. Okay, and it is also release toxins, endotoxin. It also release endotoxin. It will also cause toxic shock syndrome. Okay, it's a very dangerous pathogen, Staphylococcus aureus. Okay, same method enrichment will do, and will streak on specific media. Okay, you see in mannitol salt agar medium, this red plate convert into the completely yellow. Okay, then bismuth Bayard Park agar medium, it gives a black colonies with a white zone. This media is supplied with egg emulsion. We take egg, na? That egg emulsion we add to this media, then that white zones, so it coagulates or hydrolyze that egg emulsion, then it form a zone, white zone. Okay, this is Staphylococcus aureus on Bayard Park agar. Next, coagulase test. Okay, Staphylococcus aureus is a coagulase positive organism. So we have a plasma in our blood. Okay, when we add this Staphylococcus to our plasma, it will make coagulation. Okay, it is called coagulation. It is a coagulation positive. In laboratory, we use rabbit plasma for confirmation of the Staphylococcus aureus. You see, the first one is a control in a liquid form, and second one is a coagulation form. It make a coagulation. Okay. So up to here,
Ayurveda, Siddha, Unani, these are common test for this one. Now homeopathy drugs. Okay, whether it is required for the testing homeopathy drug microbiology testing. Why? Hmm. Hmm. Yes. Hmm. Hmm. Sir. Okay, sir. We'll discuss this no sorts of few slides after few slides. Okay. Generally, there is a normal discussion. अरे होम्योपैथी तो मदर टिंचर से बनते हैं, अल्कोहल यूज करते हैं. So why you need this microbiology test? Generally, homeopathy products are made from the alcohol. Alcohol. Of course, raw material. No, raw material. There is no question about that raw material testing. After raw material, what they will do? They add alcohol for making mother tinctures. Okay. So they will say why mm, microbial testing required for this homeopathic drugs, because but all the mother tinctures are not 70%, 80%. Some mother tinctures are 40%, 30% also they have. At what concentration this alcohol is effective on microbes? That is important. At what concentrate this alcohol is effective on microbes? On 100% or 50% or 75%? Which concentration of the alcohol is very effective on microbes? 75% is very effective. If you use 100% alcohol, it is easily evaporate. If you pour on 100% alcohol, few seconds it will evaporate. Volatile, it is evaporate easily. So there is no time to act on bacterial cell wall. If you use 70%, you diluted with some alcohol water, so it will stick with that cell wall and it act it on cell wall. So then dissolve the cell wall, then bacteria will be dead. So that's why 75% is only recommended. For this any laboratory cleaning also they recommend 70-75% alcohol. Even our hand wash also they made 75%. So that's why even some bacteria are there. They are spore producing bacteria. Okay. Alcohol is not destroy the spores. Endospores will not destroy by alcohol. The spores are resistant to alcohol. So that's why microbial testing is required for the homeopathic drugs also. Next, sterility. In homeopathy, they have sterility also. In Ayurveda, Siddha, Unani, no drug is for sterile drug. In homeopathy, ophthalmic solution should be sterile. Ophthalmic solution should be sterile. And other products are there, nosors. Nosors also should be sterile. Okay. In sterile, what we'll do, same procedure. We take the media, fluid thioclinical medium or sabro dextrose agar. So we just transfer 1 ml based on the sample quantity. We transfer it into that media, and if it is a aerobic bacteria, we keep in incubator 35 to 37 degrees centigrade 24 hours. If it is a yeast and mold or fungi, we 25 degrees centigrade. If it is an anaerobic bacteria, we keep in CO2 incubator, carbon dioxide incubator. We supply 5% carbon dioxide for bacterial growth. This Clostridium is a anaerobic bacteria. Okay. So how much quantity you have to take to transfer into this media? They have some table, sterility test. Okay. Next, no source. Okay. So how many of the here in homeopathy background? Okay, okay. And the first time this many of the homeopathy background attended for this training.
Okay. So others may know this no source word terminology. Any here? No source. No source. Sir, आप बता सकते हैं? Okay. Actually, homeopathy principle, basic principle है law of similar. Okay. Similia similis. Okay. If a patient is suffering with a fever, okay, they give belladonna. Belladonna will raise the temperature. Okay. In actually they are more Telugu peoples are there. I will say from that ముళ్ళును అని తీయడం అని అంటారు కదా. So like that the principle. हाँ, सर्विस सुन रहे हो आप? चलो, हाँ ठीक है, ठीक है. से ओ okay, हाँ वैसे means if we got one infection, we have to cure that infection with the infection. Okay, that is the principle of the homeopathy, law of similia symbolis, curator. Okay, see, coming to this particular topic, nosodes, what they will do in our HPI, we have this many nosodes, more than 14 nosodes published in Homeopathy Pharmacopoeia of India. Okay, the principle is they collect the microbes from the diseased tissues. Okay, for example, tuberculum. Okay, tuberculum is a nosode. Okay, if the patient is suffering with a TB, the patient is suffering with TB, what they will do, they collect the sputum of that patient, then isolate the mycobacterium tuberculosis, then they grow at 10 to the power of 20 billions. Okay, after multiplication of that bacteria, then they will kill that bacteria, then they filtrate it, then they make a dilution, okay, that is a process of the nosodes. Okay, it is almost similar to the vaccine technology. Okay, those are vaccines, vaccine technology, those are vaccine they are using the same principle. But what the lack of this nosodes, don't know, many people don't know that terminology. Of course, I also don't know before coming this institution nosode, what is nosode. Okay, but this nosodes also now also that samples are available in market. Okay, one drawback is no one is producing. Sir, anyone producing nosodes as per your knowledge? So please on the mic. Our directors are listening from our office.
Yes, actually, we are getting these. Some of the drugs are from the back potencies from the other countries.
So these questions also we discussed in so many homeopathy meetings, conferences also.
Yes, sir.
But there is no proper response from the industry also. They said we are exporting from the other countries.
Yes.
Okay, exporting from other countries. Then other countries, how they are preparing? They are also preparing. No? If they are preparing, we will approach them. Then we will ask them how you are preparing. Then we implement here. Even in our industry also will get benefit. This no sort. So that's why there is a very lacuna in this no sort subject.
Genuinity.
Yes. So that's why now we are take up this matter for revise this guideline. Okay. So see, whatever the product we are releasing in the market, everyone will ask how it will affect. We have to prove it. We have to give the justification scientifically. नो हमने ले लिया, खा लिया, हम ठीक हो गया, no one will believe. So proper evidence based studies are required. Now we are modifying this no source guidelines. It is under progress. Within a short period we will release that guide. This is the subject of the no source. Even SAR code also we don't have any guidelines in our HPA. Even German homeopathy pharmacopoeia, HPS, they have some no source SAR codes also. In HPA we don't have SAR code. We have one no source.
Sarcodes, the similar organs, for example, lower group of animals, for example, pancreas, pancreatic, and
Healthy organ.
healthy organ secretion from the animal, animal source.
Healthy source. No source are from the contaminated source, and no sarcodes from the healthy tissues
organs and organ secretion.
So we receive this no source samples also for testing, and we will do the sterility test for this no source.
Sir, for that OECD guidelines are there, na?
Sir,
for animal testing and some OECD guidelines are there, na?
That is on clinical trials level. That efficacy.
Animal is preclinical.
No. Efficacy, during that efficacy, they will do this OCD guidelines that are compulsory. If they want to brought the product into market, they have to do the OCD guidelines compulsory. That is compulsory. But these are prepared previously only. Now they are, say, back potencies. They are preparing from the back potencies. And these are the standards for the syrups. Whether the homeopathic syrups are available in the market. These are the standards for the homeopathic syrups. These 4 specific pathogens should be absent. Like these are the standards for the ophthalmic ointments. Next, preservation. So for every test, we are doing qualitative analysis. We are identifying E. coli, Salmonella, Staphylococcus, Pseudomonas aeruginosa. But we have reference. We also have one reference. Okay, this is similar, giving same morphology, same biochemical characters. So that's why we procure the reference cultures from the MTCC Chandigarh, and we preserve the cultures up to 4 to 5 years. Then we procure the fresh cultures. Okay. Next, this is a fumigator. Okay. The main problem in the microbiology lab is the contamination. Okay. See, whatever you without any sample also you will get the microbial load on plates. Okay. So that's why we'll do fumigation every week. We have Saturday, Sunday holiday. Then Friday evening we will do the fumigation, and Monday, after coming Monday, we'll expose the plates, empty media plates to environment. We'll keep in different rooms. Then we'll see the load. If it is below 10, then it is okay. If it is more than 10, then again we will do the fumigation. So it is also very important that load, what is the aerobic load is in our room or lab before processing the testing. That's it. Thank you for your आपको और कुछ डाउट्स है तो फिर we have practical sessions also after lunch. We will discuss in lab.
Sir, one question.
Yes, sir.
Can we use this distilled water instead of boiling water
For what purpose, sir?
for analysis of the raw material, this microbial analysis of?
Sir, there is a standard for the water also. There is a standard for the water also. IS standards are available. So that whether you are using distilled water or purified water, okay, that water should meet that guideline. Okay, that should be absent from the pathogens. Okay, there is a limit pH. It should be a 6.5 to 7 pH. It should be, and there is a electroconductivity is also there. So that water is also should meet that. We use type 3 water. We have a small millipore water unit. We use that water for this media preparation and analysis. Sir. Anyway, we will provide this PPTs also. We will provide PPTs also, raw material also.
So I have a question.
Mid-
So in HPI, it is written there are 4 types of no-source preparation: N1, N2, N3, and N4. In N3, there it is written it is prepared from purified toxins.
Toxins.
So what does that mean, purified
Toxins
toxin?
means, see, we, for example, Clostridium will produce toxins. That is
Yeah.
a tetanus toxide. Okay, they grow the bacteria, grow the Clostridium bacteria. Then after that, they destroy the bacteria. Okay, then they collect the filter the toxin. Then the toxin will neutralize with the anti-toxic agents like formaldehyde. They use formaldehyde to neutralize that effect, toxin effect. Then they do the dilutions. Similarly, vaccine also, what are the toxide, tetana, TT vaccines also, same principle. Yes.
Thank you very much, sir. Whatever your doubt or questions you may ask to sir in the hands-on training and tea also, because our next speaker is also waiting. So please join for tea. Thank you.
In regard to homeopathy also, I forgot to say, I'm also working as a member secretary for homeopathy pharmacopoeia, this HPI, what are the publications will say. One of the one my request is, just go through our website. Whenever we publish, we before publishing, we seek the comments from the stakeholder. Okay, we just go through. If any corrections needed, any suggestions needed, please write to us. Then we will modify the same thing. Not only homeopathy, even Ayurveda, the Unani also we publish in our website, the monograph standards. So you go through and give your comments.